So today we will be talking about aminoglycosides for eye especially, and in this we have three aminoglycosides that were important to study. That is Tobramycin. Number two is Gentamicin, and number three is Tobramycin. So these three aminoglycosides will be discussed in this video. So first of all, indications that why we use aminoglycosides for eye. So this is a class of antibiotics. So specifically, antibiotics are used for infections. When we are giving ophthalmic preparations that includes eye drops as well as eye ointments, then it means we will be giving it for the eye infection, and those eye infection which are bacterial in nature rather than for viral infections. And there are some off-label or accepted indications as well, that includes prophylaxis after eye surgery. Means infection hasn't occurred yet, but as a preventive measurement we are using aminoglycosides for eye. So prophylaxis of eye surgery or after eye surgery. So in this case, usually Genta and Tobra are used rather than Tobramycin. What if we see specific considerations of these medicines? Specific consideration means, can we use it while pregnancy and breastfeeding or any other conditions or not? So if a patient is allergic to Tobramycin, Gentamicin or any other aminoglycoside, then in that case these aminoglycosides for eye shouldn't be used. Okay, so allergic reaction to any of the ocular aminoglycoside, then we should not be using aminoglycosides. So this is the only coexisting condition that put us away from aminoglycoside usage. Secondly, if patient is pregnant, then it is safe to use. Thirdly, if patient is breastfeeding, then it's still safe. So only condition, that is allergic reaction, in such cases it should not be used, rather you can say contraindicated. Now what about adverse effects? Well, adverse effects of topical formulations are a little different from the systemic side effects of aminoglycosides. That includes ocular irritation, superficial punctate keratitis, or simply keratitis. While other effects include delayed corneal epithelial wound healing, retinal toxicity if there is leakage through corneoscleral wound, and rarely it causes hypersensitivity reactions that we have already discussed, that if a person is having allergic reaction, then we should not be using aminoglycosides. What about comparative data? Means comparison of gentamicin, tobramycin and Tobramycin with each other. So gentamicin and tobramycin, Genta and Tobra, both have anti-pseudomonal activity. So that is a good thing, they are anti-pseudomonal. because most of the time Pseudomonas are resistant to most of the antibiotics. And Framcetine, and that is why these two are utilized in prophylaxis after eye surgery. What about Framcetine? Well, Framcetine is not active, rather you can say it shows resistance against Pseudomonas. Okay, and more likely to cause, you can say, increased risk of causing allergic reaction as compared to Gentamicin and Tobramycin. There are some practice points as well. That includes anti-pseudomonal aminoglycosides, which includes Gentamicin and Tobramycin, are used for neonatal conjunctivitis. Neonatal conjunctivitis caused by gram-negative organisms, and also for post-operative prophylaxis. Okay. These are the indications of anti-pseudomonal antibiotics. That includes Gentamicin and Tobramycin. Next, we have to talk about Framcetine. We have seen a couple of characteristics of Framcetine, but now we will talk about specifically about dosage and specific indications of Framcetine, why it is used and why these preparations are still present in our pharmacy. Well, infections of eye and surrounding structures that are susceptible or that are actually caused by bacteria. Okay, infections of both eye as well as of surrounding structure. It could be eyelid, it could be infection of your pupil. Okay, so in those cases Framcetine is one of the option. But remember one thing, that these two conditions are means infections of eye as well as of the surrounding structures should be because of bacteria. What about dosage? Well, for bacterial conjunctivitis, but first you have to confirm that it is bacterial in nature, not viral. You have to use 1 drop. Our standard says 1 drop every 2 to 4 hours, and just for 2 days. And if there is improvement, then you can use 1 drop 4 times a day for 5 days. Okay, this is upon improvement. So the calculation is so simple now, that if you're using Framcetine for infection of eye or surrounding structures caused by bacteria, and you have been using 1 drop every 2 to 4 hours for 2 days, and after 2 days you have checked that infection is getting improved, then you have to take 1 drop or instill 1 drop of Framcetine eye drop 4 times a day for 5 days. Otherwise, if there is no improvement, then simply discontinue the medicine. This was about Framcetine. Now we have to go for Gentamicin. Well, gentamicin is very well known aminoglycoside that is available in injection form as well. And let's talk about indications of gentamicin. That also includes infections caused by bacteria, but of both eyes and surrounding tissues, as we have discussed in Tobramycin. But remember one thing, that these infections should be caused by bacteria rather than any virus or fungus. It is also accepted for infection caused or for the prophylaxis of infection after surgery. So prophylaxis use of gentamicin is also accepted, specifically after surgery. Now what about dosage? Well, for bacterial conjunctivitis, we have two indications. Number one is bacterial conjunctivitis, and other one is prophylactic use. So dosage will vary for both conditions. And for bacterial conjunctivitis, it is 1 drop every 2 to 4 hours, again for 2 days. And if there is improvement, just like Tobramycin, you have to instill 1 drop 4 times a day, means QID, for 5 days. While in case of prevention, or you can say prophylactic use of gentamicin, 1 drop is sufficient 4 times our QID until epithelium is healed. And rarely it takes more than 4 days. There are a couple of practice points regarding gentamicin, so we will see those as well. Then includes that it is reserved actually for use by ophthalmologists and for serious infections. So you have not to use gentamicin because it is reserved for serious infections. And why a couple of antibiotics are actually reserved? Because antibiotics can be resistant to a couple of strains of bacteria. And why it is important to reserve it? Because gentamicin is actually good to control Pseudomonas. And Pseudomonas has good capability to become resistant of multiple antibiotics at a time. So that's why gentamicin is one of the reserve to protect it against the resistance from Pseudomonas. And we have a couple of eye drops available that includes Minimis, Minims, wrong pronunciation, Minims, and Genoptic. These two are very well known brands, especially this one, because this is inexpensive. Okay. After this, we have to discuss Tobramycin. Tobramycin is also very well known antibiotic, but less as compared to gentamicin. It is also reserved for serious infections. And first of all, we will discuss indications of tobramycin, that again involves same as that of gentamicin. Number one, eye or surrounding tissue infection caused by bacteria. That should be bacterial in nature. And number two, again, as like gentamicin, prophylaxis after surgery. Okay. Now, if we talk about dosage, then it's almost again same. That is, in case of bacterial infection, we have to use it 1 drop every 2 to 4 hours for 2 days, and then upon improvement of the symptom, we have to use 1 drop 4 times a day for 5 days. Same like gentamicin and famotidine. But there is one difference, and that is ointment may also be used as an adjunct to drops at night. So ointment formulation is also available, but it should be used at night because it causes blurred vision. Okay. Or it can also be used 3 times a day, especially in children. And there are a couple of benefits of ointment against eye drops. What is it? Through ointment, we will have increased contact time of medication with affected area, while in case of eye drops, that reduces. Okay, this is major point regarding comparison between ointment and eye drops. As I have mentioned in indications, the tobramycin is also used as prophylactic treatment after surgery to prevent bacterial infection. So for that case, tobramycin 1 drop is used 4 times a day until epithelium is healed, just like gentamicin. And if we talk about practice points again, same as that of gentamicin, that tobramycin is also reserved for the use by ophthalmologists and severe infections which are not responding to other treatments like famotidine or any other antibiotic preparation. So this was all about aminoglycosides. Next we will talk about quinolones.